Jaundice is a term used to describe a yellowish tinge to the skin and the whites of the eye. Body fluids may also be yellow. The color of the skin and whites of the eyes will vary depending on levels of bilirubin. Bilirubin is a waste material found in the blood. Moderate levels lead to a yellow color, while very high levels will appear brown. Jaundice can happen to people of all ages and is normally the result of an underlying condition. Jaundice normally indicates a problem with the liver or bile duct. The liver filters waste out from the blood. When bilirubin reaches the liver, other chemicals attach to it. A substance called conjugated bilirubin results. The liver produces bile, a digestive juice. Conjugated bilirubin enters the bile, then it leaves the body. It is this type of bilirubin that gives fats its brown color. If there is too much bilirubin, it can leak into the surrounding tissues. This is known as hyperbilirubinemia, and it causes the yellow color in the skin and eyes. Acute inflammation of the liver. This may impair the ability of the liver to conjugate and secrete bilirubin, resulting in a buildup. Inflammation of the bile duct. This can prevent the secretion of bile and removal of bilirubin, causing jaundice. Obstruction of the bile duct. This prevents the liver from disposing of bilirubin. Hemolytic anemia. The production of bilirubin increases when large quantities of red blood cells are broken down. Gilbert's syndrome. This is an inherited condition that impairs the ability of enzymes to process the excretion of bile, cholestasis. This interrupts the flow of bile from the liver. The bile containing conjugated bilirubin remains in the liver instead of being excreted. Common symptoms of jaundice include a yellow tinge to the skin and the whites of the eyes, normally starting at the head and spreading down the body, pale stools, dark urine, itchiness. Accompanying symptoms of jaundice resulting from low bilirubin levels include fatigue, abdominal pain, weight loss, vomiting, fever. Obstructive jaundice occurs as a result of an obstruction in the bile duct. This prevents bilirubin from leaving the liver. Hemolytic jaundice occurs as a result of hemolysis, or an accelerated breakdown of red blood cells, leading to an increase in production of bilirubin. Hepatocellular jaundice occurs as a result of liver disease or injury. Bilirubin tests. A high level of unconjugated bilirubin compared to levels of conjugated bilirubin suggests hemolytic jaundice. Full blood count, FBC, or complete blood count, CBC. This measures levels of red blood cells, white blood cells, and platelets. Hepatitis A, B, and C tests. This tests for a range of liver infections. Examination of the structure of the liver if they suspect an obstruction. In these cases, they will use imaging tests, including MRI, CT, and ultrasound scans. Anemia-induced jaundice may be treated by boosting the amount of iron in the blood by either taking iron supplements or eating more iron-rich foods. Hepatitis-induced jaundice requires antiviral or steroid medications. Treatment of obstruction-induced jaundice by surgically removing the obstruction. If the jaundice has been caused by use of a medication, treatment for involves changing to an alternative medication. Prevention jaundice is related to liver function. It is essential that people maintain the health of this vital organ by eating a balanced diet, exercising regularly, and not consuming more than the recommended amounts of alcohol.